Make the ground shake.
The topic of lecture is initial caries, superficial caries, clinic, diagnostic, differential diagnostic, and treatment. The plan of lecture: classification of dental caries, caries of enamel, initial caries, caries of enamel, superficial caries. First, classification of dental caries. The definition of caries includes following points. Caries is a localized pathological process that occurs after the eruption of the tooth under the influence of microorganisms characterized by the demineralization of calcified tooth tissue and the disintegration of the organic matrix followed by cavity formation. And as for classification, there are several classifications of dental caries. First, clinical topographic classification. There is 4 forms of caries. First, the initial caries or spotting caries. Second, superficial caries. Next, medium caries. And the last one is deep caries. According to World Health Organization or International Classification of Diseases, caries are classified as a K02. The whole dental caries corresponds to code K02, and there are some undercodes of different forms of caries. K02.0 is caries limited to enamel or enamel caries and exactly white spot lesion or initial caries, white spot. K02.1 is caries of dentin, K02.2 caries of cementum, and K02.3 arrested dental caries or pigmented spot. According to World Health Organization, caries are classified as K02 and exactly the spot stage corresponds to the K02.0 code, and another name is enamel caries. The stage of white or matte spot is initial caries. Caries in the spot stage is characterized by demineralization, color change, matte surface, and then the texture, roughness of enamel in the absence of caries cavity that hasn't spread beyond the enamel dentin border. The stage of caries of dentin corresponds to the International Classification of Disease Code K02.1. It is characterized by destructive changes in enamel and dentin with the transition of the enamel dentin border. However, the pulp is closed with a larger or smaller layer of preserved dentin and without signs of hyperemia. The stage of caries of cementum corresponds to the ICD code K02.2. It's characterized by a lesion of the exposed surface of the tooth root in the cervical regions. The stage of arrested caries corresponds to the ICD code K02 02.3, which is characterized by the presence of a dark pigmented spot within the enamel or focal demineralization of enamel. Another classification of dental caries is depend on localization according to Black, who divided caries cavity into 6 classes. Class 1, 2, 3, 4, 5 and 6. According to Black, class number 1 lesion. There are all pit and fissure restorations, and they involve the following 3 localization groups. First, the occlusal surfaces of molars and premolars. The occlusal 2/3 of the buccal and lingual surface of molars, and the lingual surface of anterior teeth. Molars and premolars only occlusal surface in the fissure, molars on the buccal 2/3 surface and lingual surface of anterior teeth. Class number 2 involve the proximal surfaces, mesial and distal, of posterior teeth with access established from the occlusal tooth surface. Mesial or distal surfaces of molar or premolar. Class number 3 involve the proximal surfaces of anterior teeth, which may or may not involve the lingual extension but don't involve the incisal line angle without damage of angle. Class number 4 involve all proximal surfaces of anterior teeth, which also involve the incisal line angle with incisal line. Class number 5 involve the cervical third of all teeth, any teeth, including the proximal surface of posterior teeth, where the marginal ridge is not included in the cavity preparation. Don't involve pit and fissure areas, but more often in the cervical third of vestibular or lingual surfaces. And class number 6 involve the incisal edges of all anterior teeth and the cusps tips of all posterior teeth. Next part, caries of enamel or initial caries. First, initial caries. This is first part of caries of enamel. Initial caries is focal subsurface demineralization of enamel, which is characterized by loss of natural shine, color change in the form of a chalky or pigmented spot. And there are 2 forms of initial caries. First one, white spot, and another one, pigmented spot. And there are white spot lesion, early tooth decay. According to international classification, it corresponds to the code CAI K02.0 caries of enamel or white spot initial caries. As for its characteristic, K02.0 caries of enamel is focal demineralization, it is chalky, and it's subsurface carious, and it has acute curves, and it is called acute caries. As for its outcomes or results of curves, there are three options of outcomes. First, recovery or healthy tooth. Second, pigmented spot. It may become pigmented spot, and as a result there may be formation of a caries cavity. First, recovery, second, pigmented spot, and third, formation of caries cavity. Characteristic of pigmented spot. According to International Classification of Disease, it corresponds to the code K02.3 and it is called arrested caries or pigmented spot. It is chronic or stable initial caries and surface spot, pigmented spot, and it has only one outcome or result, only formation of caries cavity. Pathological anatomy of caries in the spot stage. The lesion has the shape of a triangle, the base to the surface of enamel. According to Silverstone and Sinitsyn, there are several zones. First, healthy enamel zone. It's inside of triangle. Next zone is called transparent zone, and it has 1% of micropores. Next zone, number 2, is dark zone, and it has from 2 to 4% of micropores. Third zone, zone number 3, is lesion body, and it has 25% of micropores. And the superficial zone, zone number 4, is surface zone, and with 5% of micropores. Initial caries is the result of demineralization, and its increase of the micropores from 0.1% to 20% in the surface layer of enamel. A layer of Darling. Surface acquired dental layer, the result of physiological enhancement of mineralization, and it remains at the initial dental caries. During initial dental caries, layer of Darling remains. As for clinical manifestation of initial caries, there are basic and additional methods of diagnostic. We use both basic methods and initial. Basic methods. Complaints during initial caries. Patient may has no complaints, or it may be aesthetic defect, a feeling of soreness of the mouth. As for anamnesis, there is time of appearance of caries spot. we find out when the caries spot appear, or identification of transferred and concomitant diseases. During inspection, we estimate spot color. It may be white, and in this case there will be the diagnosis K02.0, and it may be pigmented, and it will be another diagnosis K02.3, arrested caries. Also, we pay attention to the number of spots. It may be several or more often single spot. Also, localization. For caries, it is characterized the localization on the neck, on fissure or contact surfaces, and also presence of plaque. Next method is probing, but it is not performed because the enamel may be broken. As for percussion, it's painless. Additional methods of diagnostic during initial caries. Vital staining. Due to an increase in micropores in the demineralization focus, and we use methylene blue 2% or methylene red 0.1%. Drying. During drying, the size of made spots increases. Next method, trans-illumination. It's darkening of hidden lesion. Electro-odontodiagnostic corresponds to the norm, about 2 to 6 microampere in the frontal teeth, or from 2 to 20 microampere in posterior teeth. Luminescence is damping of ultraviolet rays. Differential diagnostic of initial caries. There are two main diseases which is similar with initial caries. First disease is fluorosis, and there are some general clinical signs. They are similar because of presence of chalky spots on the surface of enamel with a smooth, shiny surface, and distinguish signs. There are differ because during fluorosis only permanent teeth are affected. Also, spots appear in the places not typical for caries, and multiple spots arranged symmetrically anywhere on the crown of the tooth not stained with dyes. The next disease which we have to differential diagnostic to provide the differential diagnostic is hyperplasia, and between hyperplasia and initial caries also there are some general clinical signs. Both hyperplasia and initial caries is on the enamel surface. There are chalky spots of various size with a smooth, shiny surface. And as for distinguishing signs, during hyperplasia only permanent teeth are affected. The spots are located in the areas that are not typical for caries, in the convex surface of the tooth, in the area of hillocks, and characterized by strict symmetry and systematic damage to the teeth, respectively, the timing of their mineralization. The boundaries of the spots are clearer than with caries, and also spots are not stained with dyes. Treatment of initial caries. As for white spot, we use remineralization therapy. If there is compensation for the loss of mineral components of enamel is performed by applying medicinal substance containing calcium or phosphates to the surface of teeth. For example, it may be calcium gluconate solution 10%, calcium phosphate solution from 5 to 10%, solution of calcium glycerophosphate from 205 till 10%, and solution of Remodent 3% concentration. And also we may use calcium phosphate containing gels. And the course of remineralization therapy consists of from 10 till 30 applications. As for treatment of pigmented spot, it may be grinding with subsequent remineralization therapy and dynamic observation. The next part of lecture is caries of enamel, superficial caries. It's also caries of enamel, but with the damage of enamel. It also corresponds to the code K02.0, but it is called superficial caries, caries of enamel. There is destruction of the surface layer of enamel and the depth of the defect to the enamel dentin border. Till border not penetrate to the dentin, only in the enamel. Pathological anatomy of superficial caries. There are some area of decay according to Gustafsson. There are 5 zones. First zone of hypermineralization, next first zone of hypomineralization, and again second zone of hypermineralization and second zone hypomineralization, and the last one zone of decay. Clinical manifestation of superficial caries. There are also basic and additional methods. As for basic methods, during complaints we find out that sometimes there are no complaints, or it may be also pain from chemical irritants, more often from temperature or maybe from sweat. And also patient may have complaints on aesthetic defect. Next, inspection. We may find out change the color of the affected area, also defect localization, and detect presence of dental plaque. During probing, we found roughness of or caries in the enamel, and it may be painless or slightly more painful, but slightly, not sharp painful. Maybe painless, maybe slightly painful. And as for percussion, it is always painless. Additional methods during superficial caries. Thermometry. It may be painful but short term, not long. Very short term. Painful short term. Electroodonto diagnostic is standard like a healthy tooth. From 2 till 6 microampere in the front and from 2 till 20 microampere in the molars, for example molars. Laser flowmetry has indicators between 10 and 25 points. During X-ray diagnostic, we detect cavity K1 or K2 in the enamel more than 1, or the whole enamel but not penetrating into the dentin. K1 till half of the thickness of enamel, or K2 in the enamel the whole layer of enamel but not in the dentin. Differential diagnosis of superficial caries. There are 3 diseases which are similar to superficial caries, that is why we have to differ them. First one is enamel hyperplasia. Enamel hyperplasia has smooth surface and symmetrical teeth are affected. Look like this. Next one, erosion of enamel. The cavity during erosion have the cup-shaped form of cup. Also, they have smooth bottom. They are brilliant and hypersensitivity. And the third disease is wedge-shaped defect. And it's easy, it has wedge shape, smooth surface. The treatment of superficial caries. First option is polishing plus remineralization therapy. It's not typical, it's very rare option. More often we use preparation and filling. So the treatment of superficial caries, more often formation of caries cavity with subsequent sealing. And as a filling materials we use composites, glass ionomer cements or compomers. Preparation of caries cavity and filling. And the lecture is over. Thank you.